continue to curse at the idea that they didn't go to hospitals initially, but try to manage it at their private facilities or homes. You'll also help us understand how the home-based care management has sorted and helped us. You're welcome, Honorable Minister. I think I'll request your chairman here, my co-moderator, Dr. Wayengera, to apportion the questions to who best suits to answer with question. Welcome. Do it again for you.
Thank you, moderator. We have several questions, some of which will be answered by Professor Serwada, largely from the aspect of vaccines. But maybe to run through the questions, the first question that you asked, moderator, regarding variants not respecting the PCR or antigen test. Yes, we are aware about what we call the PCR negative COVID cases, and the Ministry of Health has been working with the case management to develop a criteria to enable the identification, accurate identification of these cases that test neither PCR nor antigen positive, and yet clinically they present with COVID-like symptoms. So that is being addressed. As a matter of fact, if you realize backwards, we had several cases that we had lost in this category that had not been classified as COVID deaths. And following the institution of this criteria, most of those cases were actually brought on board and our deaths climbed up. So going forward, the clinicians are using this criteria to address the issue of a negative test. The criteria will be shared, but it involves looking at signs, it looks at also investigations that have been done, and if somebody has died, the team looks at also the outcomes from the post-mortem in order to make a decision whether this was indeed COVID or it wasn't COVID. We are unlocking without vaccination. What is going to happen? Because we've not had a critical level of vaccination. I think that the minister has ably explained why we have challenges with the vaccination, and we will have to continue playing the hide and seek, and probably this emphasizes the need to comply to the non-pharmacological interventions, the SOPs. Issa Chigongo from Channel 44 asked about the denial of urban refugees vaccines. I think the Honorable Minister will talk about this as well as Professor Serwada. But it's Uganda's policy that the refugees in the country actually access all the services, including medical care. And I am not sure about the accuracy of this report. Nakato from Joyce from NTV asked, does MOH anticipate a third wave? I think we've seen this happen. COVID is here with us. For now, as far as Uganda is concerned, we know that the disease is widely spread in the community and anything can happen. If we open up and we don't comply to the SOPs, and unfortunately, you realize we've not vaccinated to the level of herd immunity for the country. That is very possible. But even where vaccination has been done to the level of herd immunity, we see breakthrough infections happen, and Professor Serwada probably will elaborate more on that. How will oxygen be transported? I think the key thing here is that in addition to procuring these oxygen plants, there will be the vehicles that transport oxygen. We've seen the ministry also procure additional cylinders for oxygen, so I don't think that will be a problem. The purchase of vaccines by private players, how will this be handled? Will they be paying NMS? The Honorable Minister will talk about that, as well as Professor Serwada. NBS vaccination achievement. What we've attributed the fall in numbers to the lockdown. What about the vaccination? Has it contributed to the fall in numbers? Well, we can only say that until when we are vaccinated to the level of herd immunity, and Professor Serwada will elaborate. The fate of those who are more than 3 months. Studies have shown that actually the longer you wait with the AstraZeneca vaccine to get the second dose, the better the booster effect. Professor Serwada will again speak to that. Should taxi drivers expect to be back?
Before the president.
That is a difficult decision. It is not taken purely by us, and the Honorable Minister will probably speak about that. These decisions are made at the level of the Intersectorial Committee and the National Task Force, so it's can't be made now. Wembley variant transportation, the risk for importation. I think Uganda has ably implemented a strategy for testing everybody that comes at the airport, and so that risk is lower, given the fact that we will not allow those who are positive to enter the country. And the issue of mixing vaccines. Can Pfizer be mixed with the AstraZeneca? Yes. Can AstraZeneca be mixed with J&J? We don't have data. We have data that the Pfizer vaccine can ably be mixed. If you've taken a first dose of AstraZeneca, you can have the second dose booster as Pfizer. But we don't have data regarding the mixing of AstraZeneca and J&J. We will probably, as information becomes available, we'll see how this works out. Has the second wave ended? I think we still have residual transmission taking place. Clearly, the minister has alluded to that. We've not purely controlled this second wave. She hinted to the fact that we need to have a positivity rate under 5% to say that we have controlled, brought this under control, and that has not yet happened. So we are still running through the second wave. Regarding remedial therapies, I think the government is extremely committed to enabling the development of any traditional medicine for the treatment of COVID-19, but that needs to be done under guidelines that are set both nationally as well as internationally. And a lot of these remedies, we appreciate that they have been in use for quite a long time, but it's also important that we take them through clinical trials to inform the practice in terms of particularly dosing, but also efficacy. The risk for a third wave, again, this we've mentioned, it is very possible that a third wave could happen. Home-based care, how has this helped in terms of sorting the challenges for, I think the critical thing is really in terms of the indicators for when somebody should be under home care and when they shouldn't, they should move to the hospital. And I think this information hadn't been communicated quite well to the public. But we believe that with the ramping up of the activities of the district task forces and the VHTs, we will have an improved referral system where those who are critically ill and need to be in the hospital are able to be referred appropriately. There is also, of course, the linkage to the health centers, which has happened, and that was previously missing. So even if you are under home care, you are attached to a health center. So you are being monitored by that health center in case anything goes wrong. I think those are the key questions. I will stop here and ask Professor Serwada. I don't know how you want to go. Do you want Aneviona to come in?
Yes, Aneviona has some questions. Some more questions I think which should also come in and have the ministers respond.
Thank you very much. I think these are the last questions I will be asking.
What about if they ask more?
Yes, because we are on time. Okay. So, Eileen, who is the spokesperson of Red Cross, is asking, if I got COVID before taking my second jab, how long must I wait to be able to get the second jab after medication? I'm requesting you to clarify whether a blood test can detect the presence of the virus. We do myth and facts about corona, so we need to clarify on this. Farida from BBS Terefina is saying, is it safe for one to take the vaccine before testing? What if one tests and he is already infected? Aren't there any effects? More clarification on breastfeeding mothers and pregnant women. Is it safe for the baby when the mother gets the vaccine while breastfeeding? From Monitor, Tony Abet is asking, National Planning Authority last week said there is no big threat of a third wave. What's the ministry saying about this? Then also another one is, what is the plan to vaccinate refugees? Thank you very much all for your questions.
Okay, now that you took in some more, one here says, people have learned how to fight the virus using traditional and local herbs. Very many people got the infection in villages, but they were able to overcome the virus without even getting admitted in hospitals. Why don't you now lift the lockdown and people go back to work? There is no name to this. And another here asks to say, I want to know whether, he says, does the vaccine also affect my manhood? It's been a subject of contention in the public where some people are actually saying they're losing their manhood to the vaccine and they want to know that. Honorable Minister, well, just before you come in, I think Professor Serwada, could you please just come, stand before all of us here and respond to a number of the questions that have been allotted to you.
Thank you very much. Good afternoon, viewers. I'll specifically try to focus on the question regarding vaccination. First of all, I want to make one statement. Prevention starts and ends at behavior change. Prevention starts and ends at behavior change. So behavior change is going to be extremely very critical. Indeed, as we're seeing the cases going down over time, if we do not maintain the SOPs to actually prevent spread, we will definitely get a third wave. As of June, about 30% of the countries in Africa were actually experiencing their third wave, and about 50 were about in their second wave. So this is going to happen, but it's not inevitable, meaning that if we maintain the SOPs outlined by the Minister of Health, we can consistently reduce transmission. A wave comes when the transmission rate has reached a critical stage that now we have a huge community spread of the infection. So, the question regarding, there was a question regarding the fact that our vaccination rates are low. And indeed they are, for the reasons the Minister of Health has outlined. But does that mean that we shall always be getting infection third waves and then getting locked down until our vaccination rate gets to a very high rate? The answer to that question is not necessarily. There is a risk, but not necessarily. Why not necessarily? Is simply because if we maintain strict standard operating procedures for reduction of spread of COVID, we can actually suppress emergency of waves. We will not eliminate COVID in the communities or in the population, but suppress it to such a level that community transmission is not high to generate a very high infection rate and therefore generate these waves. A question was asked regarding our urbans, actually, people in refugee situation, are they prevented from vaccination? To the best of my knowledge, that is not the case. In fact, yesterday we spent much of the morning discussing how, as we get more vaccines, particularly through the World Bank assistance, there's a specific segment that is going to be responsible for looking after refugees. So refugees are very much, it's vulnerable population, are very much noted as a population that has to be taken care of. And we are not aware of any policy that says refugees cannot be vaccinated. The impact, we have seen the question regarding the fact that we are seeing a reduction in transmission of and admissions of COVID cases. To what extent is this attributable to vaccination? That's a very difficult question in that, but fair to say that our vaccination rates are not that high to be able to really make a huge impact onto the transmission rates. On an individual basis, I think vaccination has really helped those who are vaccinated from either acquiring the infection or having very severe cases. But on a community population level, probably it's a bit too early to make any statement, which therefore goes back to my point, which is much of the reduction of transmission that we see is probably attributable to the fact that people have really obeying standard operating procedures, reducing high spreader events or eliminating high spreader events, and making sure they put on a mask, wash their hands, and if you are sick, please isolate yourself at home, or if you are PCR positive. I think those are going to be critical, whether we have vaccines now or even as Dr. Misaki pointed out, countries that have a very high vaccination rate, they still have breakthrough infections or new variants that spikes up, and you still have to have those standard operating procedures. Extremely very important. Now, there was a question, it's about 3 months since some people got their first dose of AstraZeneca, and they had been told they should be getting it after about 3 months. As Dr. Misaki pointed out, actually, it turns out that the longer you wait to get your second dose, people have gone up to, I've looked at a study that's shown up to 40 weeks of your first dose. Your immune response seems to be very good when you get your second dose. The good news is that Uganda is expecting new AstraZeneca vaccines in August that will really help us to ramp up, especially those people who are due to their second dose. So delaying isn't as bad as people think as we are getting more data. It's still very useful to have your second dose. Literally now our data stretches to about 40 weeks, which is very useful. Now, there was a question regarding mixing of vaccines. We have to be careful here about mixing. And as indeed the minister has indicated, there are almost up to 8 vaccines that are now approved for use. And very soon, before the end of this year, Uganda may be actually getting up to about 4 or 5 different vaccines in Uganda. As Dr. Misaki pointed out, the data on mixing is still coming in. Remember, these vaccines were first introduced in December last year, January this year. And some of these new vaccines are just being approved. You know, we have like about 6 months to 8 months use. The only data that is available for mixing is AstraZeneca and Pfizer. We do not have any data on mixing Sinovac and Pfizer, JJ, Johnson & Johnson, and Pfizer, Sputnik and Pfizer, or Moderna. Therefore, we have to be very careful, especially in Uganda, when these vaccines are not going to be that plentiful. There are countries whereby they can go in and make a decision. Say, I got AstraZeneca, and I want to have Pfizer. That we know you can mix. But there is an opportunity to make a choice. The Minister of Health will give guidance as we get these vaccines as to how this will, in practice and implementing here, will work moving forward. There was a question regarding somebody has got COVID infection, and he wants to get his either first or second dose. How should he or she go about it? When you get COVID infection, it somewhat boosts your immunity. So your antibodies to COVID virus goes up. So when you immediately get a vaccine, that vaccine may not take. In other words, it quickly gets mopped up by the antibodies. So we recommend that there's a period between getting your negative PCR as evidence that your infection has resolved to actually getting your vaccine. This should range anywhere between 3 months and 6 months. In that period, you should be able to get your vaccine, but not immediately soon after your vaccination, soon after your infection. So I think that is a fair, safe, so you need to wait until that period is over. Otherwise, the vaccine is not going to take. Now, there was a question whether we should get a third booster. At this point in time, most vaccines that we have are being used are actually effective up to so far, even with the new Delta virus. However, the question of whether we need a third booster in the future is still a question out there. You see, vaccines, we have just had vaccines since January, December. We are still figuring out or studying how the immunity wanes over time with these vaccines. And it is possible that as the immunity, we are observing more and more people over a period, I think we are beginning to see that there's immunity that wanes, starting to wane around 6 months to about 8 months. But this is still very early period. So it is very possible that a third booster may be required, But at this point in time, we do not have very conclusive evidence that that is now a requirement. So this is something that will be communicated and to the public as and when more data becomes available. It's not uncommon in vaccinations to have 3 boosters or 4 boosters as time goes on. In most of our immunization programs for the under 5, we tend to have pertussis, tetanus. There we give several boosters over a period of time. This question is so important, breastfeeding and vaccination. It has been coming in this forum, in this house, in this broadcast often. And we always answer it. The benefit, if you are breastfeeding or if you are pregnant, the benefits of being vaccinated outweigh any possible risks for COVID during pregnancy or breastfeeding period. So the answer is yes, you should be vaccinated if you're pregnant or if you're breastfeeding, and it's fairly safe. Thus far, we haven't seen any complications we have noted in the Uganda database of people who have been vaccinated with those with pregnancy or breastfeeding. Manhood. This is a question that comes up. If it's not manhood, it's whether it will affect my fertility, ability to produce. Thus far, we have not seen any effect of these vaccines, any of the vaccines on manhood, all indeed affecting people's ability to become pregnant. So this is something that is going around, but I'm here categorically to say that we do not have aggregate data to suggest that this indeed, this vaccine does cause effects on manhood or on fertility. Dr. Misaki, can you remind me if I've forgotten anything before I leave the floor?
Is it safe to take vaccines without testing?
Oh, testing. This question also comes up all the time. Should we be tested before we actually get vaccination? All programs in the world do not test before you get a vaccine at all. So we do not test before we get a vaccination. It's possible that during testing or during the process, there may be some people who may actually be infected. Just like with any disease, sometimes we may vaccinate children when they have already been exposed to measles. But by and large, the majority of people will benefit. Therefore, in terms of operational cost of rolling out vaccination program, we think that testing is not required, and therefore, yes, you can go. You don't have to be tested first before you actually get a vaccine.
Professor Sarada, just before you step down,
yes.
Your earlier submission was about cautioning us on prevention. Could you just say those statements in Luganda in just 1 minute?
Cautioning us about?
The prevention, your opening remarks,
yes,
on how to manage our behavior change and all the things. Could you just say that in Luganda in maybe just 1 minute or 2?
Okay. Good afternoon, viewers. Njagala okubawugawayo akagambo kamu ku bigambo bya COVID ne prevention of spread of COVID. Mu prevention oba okuziyiza okufuna obulwadde, kintu kimu ekikulu ennyo. Okuziyiza obulwadde kisinziira mu behavior, mu nneeyisa y'abantu, oba HIV oba COVID. Abantu gye banaasinga okuteeka essira ku okugoberera standard operating procedures za government okuziyiza obulwadde bwa COVID, gye banaakoma okugondera ebiragiro, gye bajja okukoma okuziyiza obulwadde buno. tetulina enough drugs, tetulina enough vaccines anywhere in the world that will actually eliminate COVID. Naye okendeza kuba nti oyambala mask, onaaba mu ngalo, togenda nnyo mu binyumu oba mu nkuŋŋaana ezirimu abantu abangi. Ekyo kijja kutuyamba nnyo okukendeeza obulwadde buno okusinga ekintu ekirala kyonna. Ate kiri cheap and kiri sustainable. Thank you.
Thank you, Professor Seradat. Honorable Minister, just before you come in, there are two, I think, questions here that are directed specifically to the ministers, Honorable Muhanga and the Honorable Bangirana. To both of you ministers, as members of Parliament, it is, of course, known everywhere that you took yourselves as members of Parliament money for cars worth over 7 million doses of Astra. Wouldn't you just sacrifice this entitlement for the sake of Ugandans at this time? If all of you gave your money to the struggle, would have over 7 million doses of Astra. Now, this is some mathematics done by some Ugandans out there. And secondly, isn't it a violation of my right if I am coerced or compelled to take a jab? Don't I have a right to say I do not want any vaccine? And maybe to Honorable Minister, you'll talk about the double masking. I think it would be good for Dr. Kajumbla, who is not here. It's also said or believed that the double masking will eventually also cause what they call community pneumonia. How about that? Because we've struggled with one, and I think we're managing the one. Now, here comes in the second one. What will happen for the people in the future? Won't we also fight COVID and again develop what they call community pneumonia because of maybe what will come out of the double masking? I'll request Honorable Minister that before you come and respond, yes.
Shall have Honorable Margaret Muhanga come in to emphasize on a few things and answer some questions. Thereafter, we'll have Honorable Anifa Kawoya. I will come in at the end.
Yes, thank you very much. So, Honorable Muhanga, please, welcome. One of the questions is the 200 million shillings for all of you, the 7 million doses for Ugandans, that is going to be driven by all members of Parliament.
Thank you. Welcome, comrades, and thank you, Minister, for that presentation. The government of Uganda has got the channels through which they are purchasing these vaccines. And as far as I can understand, the minister has just talked about it, that even if you have money here, there's no access to vaccine, easy access. Otherwise, every government is able and willing to vaccinate their communities at whichever cost, because we need healthy people. But most importantly, the public needs also to comply. You know, we all live in Kampala suburbs, and you know what is going on. We reach many places where we find people seated, they've not come from the same home, but they are seated together, drinking from the same glass, talking with their masks on the chin. If you want to take off your mask, you can keep by yourself or with members of your family. But the moment you get out, you really need protection. And this protection comes with behavior change. Precisely what the professor has said. If people can change their behavior and make a distance, stand at a social distance from their colleagues, it will save a lot. Imagine just a few days of lockdown. We have already started registering a very fast trend downwards of COVID cases. Now, let me give you a scenario. Because, of course, Uganda is a highly politicized country that even young children like to talk about politicizing each and everything. But COVID is an equalizer. It has really equalized us. It is most importantly your body immunity that will fight COVID. Because as all doctors have been telling you, there's no cure yet for COVID. All the things we are doing are preventative measures to contain, like to help you live, but not that you're going to cure from COVID because of this or the other medicine. And also as new variants come in, we are facing new challenges. Imagine in India, where they would register deaths alone of 6,000 plus people daily. What would they say about this COVID? In the US, they would lose 4,500, 3,000 at the peak of their second wave. Uganda is one of the countries that have been hailed the world over for containing this disease. We have a very good name everywhere else except here at home, which is very unfortunate. There is a saying that the grass is greener the other side of the fence. We would be looking at those countries with the best health care systems. Look at a country like Italy. It has a very good health system, even US. But these countries nearly went to their knees because of COVID. You remember in the UK last year in summer, people were being chased by sniffer dogs from open spaces. It is so difficult for people to adhere to the rules. But if we did that, COVID, like everybody else has been telling you, cannot move itself. You get it from a person you are in close contact with. And sometimes for social events, or for social activities, because if you don't attend a funeral or a wedding, people will understand you. I've been attending so many social events on Zoom, because these days almost every funeral is on Zoom. I've attended those of 300 people, even when the ministry has said not more than 20 people. Sincerely, how far is government going to police us on our own lives? How much can people sacrifice? People are walking in the night, these policemen, LDUs, soldiers, to police people to disperse. Let us also take personal responsibility in some of these matters. I thank you.
Thank you, Honorable Minister. Honorable Bangirana.
Thank you so much, and good afternoon to all our viewers. I want to thank the Senior Minister for the statement that she has given out this afternoon, and my colleague and the rest, Professor Serwada and Doctor, for responding to the questions that have come from the press and the public. And I want to thank everyone that has participated in the fight against this COVID-19 second wave and first wave. And on behalf of the Ministry of Health, I want to condole with those that have lost their dear ones. And we pray and wish quick recovery to those ones that are still battling with the disease. We are with you, and we are doing as a ministry and government all it can take. Yes, moderator, I want to attempt the two questions. MPs and car monies. I think that one is best to be directed to the Minister of Finance. As simple as that. The right to refuse to take a jab. Really. There is a right also to a living. So the question here is, your right to refuse to take a jab and you transmit in the unlikelihood the disease to the other person or persons. So I think as Parliament, we should look at the current Health Act and see how we should address this issue. Somebody's right to refuse and infect others, and the right
To life.
to life. I think Professor Serwad would have been that, but you put it to us as the policymakers. Right to life against right to protect yourself or to refuse, and you say it is your right. I wouldn't like anybody taking that route. I wouldn't, and I would appeal everybody to go and get vaccinated. We have seen, and we have known, and we have heard from the scientists, and Professor Serwad has emphasized on it. Those who are vaccinated have better chances to survive from further infection and from transmitting the disease to other people. That's the beauty why we are saying we should have massive vaccination. The chances of having a sick population once the population is massively vaccinated is minimal.
Okay.
So I would appeal to our viewers and to the population that let's all of us, as my colleagues have said, and Honorable Minister Mhanga has elaborated, our responsibility is upon all of us. Maybe I have one other thing to talk about, just to supplement on the minister's statement.
Please do.
And that one, just briefly.
Please do.
The lockdown, because most questions were surrounding on the lockdown. And the minister has elaborated on the achievements by government and the Ministry of Health. But there are achievements also that have been recorded as achievements by the communities or the population. So this achievement of now seeing the current wave going down is not from government only. It is by participation of the population, as the minister has said. And these achievements further go to behavioral change, behavioral attitude. In the first wave, everybody was saying, if I can say it in Uganda, or it is something that COVID is not there. The epidemic is not there. Now the population has come out to appreciate that COVID-19 is real, preventable, and manageable. And we thank them for change attitude and appreciating that it is a responsibility now for them. Cross-border restrictions in this, where we are within 42 days. You have seen it has also reduced in transmission from border to border, from communities to communities. So we do appreciate that also cross-border restrictions, movements, they have contributed to other contributory factors. And this is where we are saying that the behavioral change within our population. The Honorable Minister has talked about visual usage. The population is now adopted to Zooming. Most of the barriers, now we attend the barriers through Zooming. We too have lost so many relatives, but they don't understand, and now it is Zooming. So that is another achievement that the population. At barriers, religious functions, services, you can see now everything is going. Holding meetings, people are appreciative that yes, it is safe for all of us. We can go through Zooming and we continue with our business. The last one is about community-based care.
The home-based care.
Community home-based care. Yes, I do take note, or we do take note that patients stay long in their homes. And at times they go to the health facilities late when they are critically ill. But then there are some achievements. Some of these achievements is that once even the patients are managed at home, under the guidelines that the Ministry of Health issued out. And this responsibility, surveillance, monitoring is under local government, together working with the VHTs. The transmission also of patients from home to health units is limited somehow. And with the minister, as the minister says, that the districts, of course, another issue of the day was because they couldn't have facilitation, transportation. But now they will be getting it. So I want to conclude and say that even stigmatization, everybody now is appreciating. So I want to say the community-based home care has also added to see that the cases are slowing down. I thank you so much. Okay. I appeal to all of you, viewers and the population, we continue observing the SOPs and other directives in place. Thank you so much.
Thank you. Honorable Minister, we need to close the start because many newsrooms are actually planning and getting ready for their bulletin at 1 o'clock. But Margaret here, Mwirumumbi says, is it okay for anybody to take their second dose when they're on medication of any type? And maybe finally, the reduction in rates. Are you sure that there has not been any default on the different task forces to submit the results? Could the numbers have lowered simply because they're not submitting cases, or they're not coming through, or everybody is doing what they're supposed to do, and that's what we're getting? Respond to those, Honorable Minister, and we end it there.
Thank you very much. Well, I will respond to a number of questions. Let me first state here that it is not true that the second wave has ended. In my statement, I indicated that we are recording an average of 295 confirmed cases per day with a positivity rate of 10%. So that means we are still in the second wave, although it is going down. Okay. So people need to take note that unless it is less than 5%, we are not yet out of the challenges.